Greetings, friends and followers. This is Nurses Talking, and I am Dale Barzy. As always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I'm very, very pleased to welcome LaTaya De Jesus. LaTaya is a nurse practitioner. She's triple board certified. She is an Army vet. She's the founder and CEO of Eden Health Restored. She says that she seeks to serve the Lord Most High by answering his call to serve others, and he has led her throughout her healthcare journey. And LaTaya credits him for all that she has accomplished. So, welcome, 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 LaTaya.
Thank you. Thank you. I could not have introduced myself any better.
Well, you have earned it all. So, and there is more.
Well, glory be to the Lord.
There is more.
I appreciate you extending the offer to be on the invitation to be here today.
It is my pleasure. It is my pleasure. It's been a long time that I've wanted to speak to nurses. I've thought for a long time that I would just love to talk to nurses anywhere and see what they're thinking and what they're doing and stuff like that. So I'm grateful to be able to do this.
Yes, this is awesome. And then technology makes it a reality, right?
So tell me, what though? What inspired? Who or what inspired you to be a nurse?
It's been the Lord, because I actually had no intention of going down the medical field. This was my sister's desire and dream. And I actually wanted to be a forensic scientist.
Okay.
And I got my first degree in criminal justice, and I was going to go back to get my degree in forensics. And between that time, I wanted to work in law or like in the criminal field. And I'm telling you, I could not find, I could not get an interview for any job in that field. And I remember getting a rejection letter. And I was sitting at a mailbox and I was like, well, Lord, what is it that you want me to do? This was my first time asking the Lord, like, what do you want me to do? And then the ball started rolling. I ended up joining the military, and all that was orchestrated as well. But I don't think we have the time for me to go through that testimony. But I became a medic in the military, and I began to love the medical field. And so then I got out, went to nursing school. I was in a program that was a veterans to BSN program, so only for veterans.
Yeah.
Then, yeah, so that's pretty much how I got into it. And I started working. I really loved like trauma. So I worked in the emergency department right after getting my passing the boards.
Yeah.
And that was fun. That was great. But like traumas don't come in every day, right? So praise God for that, right? But I did see a lot of people that were frequent flyers, people that came in for same chronic diseases. And I eventually wanted to go back to become a nurse practitioner in order to be able to help my patients so they weren't coming back always in the emergency department, for chronic diseases.
Yeah. So you came into nursing with a deal of experience. You were an Army medic. You had a degree in criminal justice. You had rejection letters. That's experience in itself. So what challenged you when you got here?
What challenged me? That's a great question. The thing that comes to my mind is just teamwork, because what stood out most is in my first job as a nurse, I was working in the emergency department, right? And I experienced like I was on the receiving end of the saying nurses eat their own. And that was a challenging time for me. It caused me a lot of anxiety. I didn't want to go to work. I cried during my breaks. I was calling my husband. Like it was difficult. It was a rough time for me. And so when I think about my challenges, that's what I think about. That's what I think about, because I wanted to quit. I wanted to leave. Like it was rough. It was rough.
Yeah. I understand that. I understand that completely. There are so many of us who get there, like we're like, I can't do this anymore. And guess what? The next day we're back.
We are, yeah.
Yes. We're back. So
We
what kind
are.
of areas did you work? Other than emergency room, just emergency room?
Yeah, so no, actually I worked there, but then we also had like psych patients would come in through the emergency department. So because sometimes I was the nurse overseeing that section, I felt like, okay, well, I can pick up some shifts, like do PRN on like a psych unit, because I'm a little bit familiar with it, because they, we have like a little area in the emergency department. So I actually did I worked like 2 shifts a month.
Okay.
On the
Okay.
site,
On site.
report.
Yeah.
Yeah,
Yeah.
yeah.
Yeah. So currently, I see you're into lifestyle medicine.
That's correct. Yes.
How how did you decide that this is where you want to be? Because this is your current specialty, I'm assuming.
That's correct. Yes.
How did you decide that this is where you wanted to be? And how did you get there?
Yeah. So again, I probably say this so many times during this conversation, but the Lord really put that on my heart. And He is so good that He sets everything up. First, I became plant-based myself, me and my own family. And this is before I was even a nurse. And when I started to see the patients coming in the emergency room for diseases that they could reverse, I was like, okay, well, I know how they can do it. I just don't know how to teach them how to do it. So like if I become a nurse practitioner, how do I teach them how to do it?
Yeah.
And the first year I was in school to get my master's and my doctorate, I met my mentor. His name is Dr. Drozik, and it just was so set up. Like it was set up like the way we met. And he told me about lifestyle medicine, and he would see patients, and then I like shadowed him that first year, and then I ended up becoming certified and stuff like that. But I want to kind of back up, because not a lot of people know what lifestyle medicine even is, right? And I like the way my mentor, Dr. Drozik, puts it. He says lifestyle medicine optimizes modifiable risk factors to reverse, manage, and prevent chronic diseases. And some of these diseases are like type 2 diabetes, heart disease, even memory loss and dementia. There was a study that recently came out on that back in this past June. So many things, multiple sclerosis, like the list goes on of how lifestyle medicine can reverse and prevent and manage chronic diseases. There are 6 pillars. They're the plant-based eating or plant predominant eating, exercise, restorative sleep, avoidance of risky substances, mental health, and nurturing relationships. So I'm certified in lifestyle medicine now, and I'm able to teach my patients or my clients how to, make changes in all 6 of those areas so they can improve their health, so yeah. Yeah, what else you want to know about lifestyle medicine?
I was about to say, I was about to say that must be extremely satisfying, because you came into a healthcare system that is almost the exact opposite of that.
Yes, you're right.
And so to segue from that to this and see results must be extremely satisfying.
It is. It really is. When I worked in primary care before, the staff, they would say, like, I would see patients in the office for lifestyle medicine visits, and when they would come back and I would like see their labs, or maybe they lost weight, maybe their goal was to lose weight, whatever it was, like I'm taking people off medication, the staff would say, you're like a kid in the candy store, because I was so excited. Like anybody can write a prescription, but
you know this.
Yeah, just seeing them implement those changes and be able to get off medication, because prescription medications aren't meant to cure you of your disease. It's meant to like keep you coming back. So
yeah. And the thing is, you just talked about people meeting their goal. doing things like losing weight and stuff like that. But very often, what I understand, and I myself am not into lifestyle medicine per se, as you are, but some of those things I do tend to practice. What I notice is that people, they meet the stated goal, but they also see the other benefits that come with it. So they lost weight, but they saw their skin improve, and they feel more refreshed when they wake up. And these are things that people say.
Correct. You're absolutely
What
right.
happened?
Usually I don't tell people what they're going to expect, but every single time they come back and tell me, I feel like I have so much more energy. I'm
Yeah.
already expecting them to tell me that. And just recently I had a client, she was being seen, she was referred to her primary provider and to lose weight. And she told me, she was like, LaTaya, I stopped biting my nails. And she didn't realize that she stopped doing it. She has like anxiety. And she was like, I didn't even realize that my nails are growing out. And that's because I'm not biting them anymore. But yes, like what we put in our body usually is a manifestation. Like our diseases are a manifestation of what we put into our bodies.
Yeah. Yeah.
Depression and anxiety is the same thing. So when we tackle the root cause, which usually our lifestyle is the root cause, you see changes everywhere else, not just weight loss, like you were saying, but in depression and anxiety, in your A1C levels, in your cholesterol, so you're absolutely right.
Yeah. And I say that because people are not expecting the traditional way, actually. People are not used to seeing the side effects of the good changes that they made, of the changes that they made. If you see side effects, it's something unpleasant. So when you do something different and you see a side effect of, I'm not biting my nails, my skin looks better, my hair is growing, and I'm like, and those kinds of things. I hear that frequently from other people who take a different route.
Right.
You've been a nurse for a while now and worked in different areas. What would you like to see change in nursing?
Yeah, so staffing.
Yeah.
There's just so many implications to staffing when we're short staffed, right? And it's just it's just bad. It's understaffed, overworked, undervalued, underappreciated. Like I feel that's where nurses are. And because nurses are so caring, they get taken advantage of. And so you don't want to leave your coworker hanging, right? So you might pick up another shift or you might work over. You don't want to leave the patients because they need you, right? They need the care.
Yeah.
And so why hire more nurses when the nurses we currently have are going to do it because they care so much? And it ends up the nurses suffer, the patients suffer because nurses get in car accidents if they fall asleep driving, or some get so burnt out, there's the suicide rate, and then
very high.
Right, exactly. And then you have the patients that suffer because nurses are not they're overworked, so their mind is not sharp. So staffing needs to change. It does, but healthcare is a business, right?
But the funny thing is that what I think is not being realized is that people look at the nurses suffering, the patients suffering, all of this. Business suffers as well. And somehow or other we seem to be just like, well, we'll just take that. But if a successful business is your end goal, then it behooves you really, one of the things is really to make sure that your staff, including especially your nurses, are well taken care of, which includes staffing, which includes time off, which includes, because very often people don't get the time off that they have earned.
That's true. Yep.
And includes all of those things. And I don't know. We don't seem to be able to see the big picture.
Not at all. And, you know, if healthcare was free, like in some countries, it might be a different story. I met when I was in the service, we were training the British. I think she was from Britain. We talk now and then, but she was a medic, and she was telling me that they don't get paid a lot. They don't, like, in the civilian world, nurses, they don't get paid that much. So if you are in the field, you're in it because you really want to be there.
Yeah, yeah.
You know?
So here's the other thing that I want to know. I have been a nurse now for like 50 years. And as I look back, I see, especially in the last 5, 10, 15 years, so many changes. And a lot of those changes in the last 5 years or so have to do with technology.
Yep.
When you look ahead, the next 5, 10 years, how do you see technology impacting the way you as a practitioner deliver care?
So it just keeps like going, right? Like we have AI, which we were, you know, talking about a little bit before. And that's just kind of blown up. There's so much to do there. And then there's virtual reality. I know, so I attended the Ohio State University, and we have virtual reality now for the nurses there. And like, I don't know what type of way they're probably incorporating AI now that that's available into that. But like, I have even looked at different things that I could use as a lifestyle medicine provider. Even now, they have the apps that you just take a picture of your plate and it will calculate how many calories you've consumed, like all your macros, and you didn't even have to put it, like, this is crazy, right? Like, I'm like, how the human mind is God has created us to be brilliant creatures, you know, and so sometimes I can't even think about what's going to be next. Like, what more can you do?
That's it. That's it. That's it. Because I agree with you there, in that I find that I'm trying to catch up. I feel like I'm constantly trying to catch up with all this technology, and it's moving at warp speed.
Yes.
So I wonder, what's nursing gonna be like in the next, I don't know, 5, 10 years? Am I even gonna recognize?
Listen, I don't even know. Like, I told somebody they'll probably have, like, I don't know, holograms where you can like be in the patient's home and do assessment. I just don't know. Like, I don't know where else you so
I don't know. I don't know. Amazing, amazing. It is not, I mean, it scares some of us, I know that, but it's not all a bad thing.
no.
But you know, I think so many of us are just gonna get left behind. Like, what happened?
I'm right there with you. I feel like I'm gonna be part of that group. I kind of secretly I hate change. So like, I don't want to get comfortable with something and then you're throwing something else into the box, you know. But
So LaTaya, if you could describe for me what you see as the most essential quality of a nurse in one word, what would that word be?
one word, I would say humility.
Humility.
Yeah.
Okay.
Humility. Just because I mean, we have to have a desire to serve others. Some people, you know, they get into the medical field for wrong reasons. But for those who are going for the right reasons, we have to have a willingness to humble ourselves and serve others. And this is not just our patients, but serving our peers around us as well, like the other nurses, the techs. I really appreciated my techs, and I would let them know all the time, like, how much I appreciate them. But nothing is beneath us neither, because sometimes we get to that point where we're too good because we have our BSN, but we don't want to forget about the why we got started in here. But I will say we don't want to be mistreated and walked all over neither.
I think we're getting to the point where we're not taking that anymore. I have to say that I'm very happy with the generation of nurses that I see coming along who are saying, listen, no, we're not doing this.
Yes, I agree. Setting those boundaries and knowing what you're going to tolerate for patients and staff. So
yeah, exactly. So we talk about, the potential for overwork and all of that and burnout. What do you do to care for you?
So caring for me, so that's like a time of rejuvenating. So that looks like playing board games with my family. I love to read, writing. A lot of times my gifts, people gift me with new notebooks to write in. And I also love the garden, and I know you like the garden too. So yes, I love gardening. It kind of, it connects me with nature and the Lord, and I just really love it. I'm actually starting my fall garden now. I got to get one of my boys to go cut some stuff down in the garden. But
you bring up gardening, and there are so many things that I like to do, but none of it is like gardening. It just it takes you into a different plane.
I agree. I agree. And then you get to see just like the seed become, a sprout, and just the process of it. Like it's amazing. Then if you do like canning and all the other stuff to but
yeah. And you get to eat your own food. Oh,
exactly. You know what you did with it. You know what you've done with the soil. You know what you did or did not spray on it.
Yeah. There's nothing quite like it. It's there's no real word for it. We'll just take gardening.
Yep. That's what I love.
Yeah, I love it. LaTaya, it has been a real pleasure to speak to you. I really have enjoyed this conversation. Any gems you'd like to leave us with before you go?
That's a great question. So I just wanted to let other nurses out there know that, or even people who are interested in becoming nurses, like looking at things like this, like watching podcasts like Nurses Talking is such a good way to find out about the different types of nursing out there. And so, just jumping in there before jumping into nursing school, but just kind of like doing your research not just on the internet, but actually listening to other people. So that's a big thing that I would just want people to take away. If they're not nurses, those who are interested in becoming nurses. Oh, you know what else I will say? Really quick, when we were talking earlier about like when I said I wanted to quit, I actually thought about like, this is not the only position I can be in as a nurse. There's so many different fields.
Yes.
Such a diverse field. But
yeah, that's a big thing, and I'm glad you brought that up because nursing is huge. Absolutely huge. I mean, you never have to see one drop of blood if you don't want to.
Yeah.
There isn't anything, I tell people, there isn't anything you cannot do if you're a nurse. Now, that's like a license to do any and all things.
Right. Whether it's, direct patient care or administrative, like it's so much.
Yeah. And our nurses, I see are getting so much more, so innovative and so bold with their innovations. I love it. And taking the credit for what they have done.
Right. And I noticed that too, because I noticed when the innovation is nurse driven, it's so much different than when it's an outsider trying to determine what the nurse needs.
Yeah, yeah, yeah. But I'm glad that we're stepping up and doing that, because for too long we just let other people decide what we needed. And now
Correct.
we're saying no, 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 no. We know what we need and we're gonna go get it.
We know exactly.
Yeah,
Yeah. And I'm glad about that too. I'm glad I'm seeing that as well. It definitely makes a difference.
absolutely. Absolutely. LaTaya, thank you so, 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 so much. It's been my absolute pleasure.
Thank you. It's been my pleasure. I appreciate again the opportunity to be here. And now that I'm sweating everywhere.
Yeah. We will do this again.
That would be great. Thank you.
Okay.